If you've been doing everything right and still wake up with blood sugar levels between 110 to 150 or even higher, you're not alone and you're definitely not broken. Today, I'm going to give you a clear science-backed answer to the question I constantly get. Does berberine really lower blood sugar? Short answer, for many people with insulin resistance, prediabetes, or type 2 diabetes, yes. When you use the right dose, the right form, and when you pair it with lifestyle changes that make your cells listen to insulin again. No hype, no miracles, just physiology you can actually use. Let's start with what berberine is and why dietitians like me even care. So berberine is a natural plant compound found in barberry, golden seal, and Oregon grape. Inside your cells, it flips on a master regulator called AMPK. I like to call AMPK your metabolic CEO. When the CEO calls the shots, a few critical orders go out. Your muscles become more insulin sensitive and pull more glucose from the bloodstream. Your liver eases off the overnight sugar dump, and your fat cells shift from hoarding energy to burning more of it. That's why the research doesn't just show a single benefit. Across trials, you see improvements in fasting glucose, A1C, triglycerides, and cholesterol, because you're addressing multiple pathways involved in energy metabolism, not just masking high blood sugar. This is also why I teach berberine as a tool, not a crutch. It supports the master plan: proper food, enough fiber, consistent movement, deep sleep, rather than replacing any of those key fundamentals. But does it actually work in humans? Well, we have solid evidence that it does. A large systematic review and meta-analysis combining dozens of clinical trials involving thousands of people with type 2 diabetes found that berberine significantly lowers fasting glucose and A1C, and it also improves triglycerides and cholesterol. And in direct comparison, its glucose lowering effects was similar to metformin in a 3-month trial. Another comprehensive meta-analysis of randomized placebo-controlled trials found that berberine significantly lowered fasting plasma glucose and triglycerides and improved secondary markers including LDL and total cholesterol, 2-hour glucose tolerance, and body composition, indicating broad metabolic benefits beyond glucose alone. That's clinically meaningful because long-term risk lives in those trends, not just today's finger stick. On body weight, we need to be honest, people typically lose a modest 3 to 5 pounds over 12 weeks. Helpful, yes, but not magic. The bigger win is more efficient metabolism. Your body handles carbs better because your cells are listening to insulin again. So if the evidence is this encouraging, why do some people say berberine didn't work for them? In my experience, it usually comes down to 5 missteps. First, the dose is too low. Many bottles look affordable because they're underdosed, 200 to 400 milligrams per capsule. So you need to swallow a handful to hit the research-backed range. The clinical sweet spot is 1,000 to 1,500 milligrams per day, and in practice, 1,200 milligrams is where most people land. 600 milligrams with breakfast or lunch, 600 milligrams with dinner. Second, the form is wrong. Nearly all of the human trials use berberine HCl, hydrochloride, often standardized to around 97%, not liposomal versions or metabolites like dihydroberberine that haven't been studied head-to-head for outcomes. The hype is there, but the clinical results are lacking. Look for berberine HCl, hydrochloride. And third is inconsistency. AMPK and insulin sensitivity improve with steady exposure. You need 4 to 6 weeks to see fasting glucose move significantly, and 2 to 3 months to see A1C come down. Fourth, taking it on an empty stomach if you're sensitive. If your gut is a little finicky, take it with meals to minimize any cramping or loose stools. And finally, lifestyle working against it. High saturated fat intake, low fiber, low muscle mass, poor sleep, and ongoing stress all send the opposite signal you're trying to send. Berberine wakes up the CEO, but your daily habits decide if the team follows orders. Here's the exact protocol I recommend as a dietitian, aligned with what the human trials already use. Total daily dose, 1,200 milligrams split as 600 milligrams with breakfast or lunch and 600 milligrams with dinner. If your stomach is sensitive, start with 600 milligrams once daily with your largest meal for the first week, then increase to twice daily. Timing wise, you can take it with meals or about 15 to 30 minutes before. Taking berberine with food makes it more gentle and makes compliance a lot easier. Look for berberine HCl standardized at 500 to 600 milligrams per capsule. And because quality matters, check for third-party testing. So for heavy metals, microbes, potency, etc., and manufacturing in FDA registered, GMP, and NSF certified facilities that start marketing fluff that's safety, consistency, and results. And set your expectations. Evaluate fasting patterns at 4 to 8 weeks. Reassess A1C and lipids at 8 to 12 weeks. And a note about medication because safety always comes first. Berberine can be used alongside metformin in most cases, and mechanistically, they complement each other very well. Berberine can quiet hepatic glucose output and improve peripheral sensitivity, similar to metformin. But if you're on insulin or sulfonylureas, or you use multiple glucose-lowering drugs, you must loop in your clinician before starting and be prepared to have a plan of action with them. As your numbers improve, your meds may need adjustment to avoid hypoglycemia. There are also potential interactions to be aware of. Medications metabolized by cytochrome P450, certain sedatives, immunosuppressants, anticoagulants, antihypertensive medications, etc. Some of these have been flagged, and berberine is definitely not for pregnant or breastfeeding women, and it should be avoided with severe liver or kidney disease and certain heart medications. If your situation is complex, don't DIY this, get medical oversight. What about side effects? The most common side effects are digestive, so cramping, loose stools, gas, and they're usually mild and temporary, resolving over 1 to 2 weeks as your gut adapts. If you're sensitive, use the start low, go slow approach and always take it with food. A high quality probiotic can help some people write out the adjustment, especially if your baseline gut health is off. If symptoms are severe or just persistent, stop and talk with your clinician. The goal here is a sustainable protocol you can stick with, not pushing through misery. Now let's talk about what makes berberine work faster, better, and more sustainably, because this is where the magic happens. Think of berberine as a signal amplifier. If you feed your body the right signals, the amplifier makes them louder. If you feed it mixed signals, the amplifier just amplifies the noise. Start with fiber. Aim for 25 to 38 grams per day. Fiber slows glucose absorption, flattens spikes, and feeds your gut microbiome, which produces short-chain fatty acids that literally help your cells respond to insulin. This is why so many of my clients finally feel free to enjoy fruit and whole grains again. When fiber is high and fat quality is right, their post-meal numbers calm down. Speaking of fat quality, keep saturated fat under roughly 6% of total calories. Excess saturated fat gums up insulin signaling at the receptor level in muscle and liver. Swapping towards unsaturated fats in reasonable portions supports sensitivity without fear-based restriction. Comment guide below to get our free meal plan that helps reverse insulin resistance and increase insulin sensitivity to lower your blood sugar levels. Next, make muscle your priority. Muscle is your glucose vacuum. More muscle means more suctioning power. A simple, repeatable baseline is resistance training 2 to 3 days per week for 30 to 40 minutes using bands, dumbbells, or just your body weight. Then layer in 15 to 20-minute walks right after meals. During movement, your muscles pull glucose in through contraction-mediated uptake, no insulin required. In fact, a randomized control study found 3 15-minute walks after meals were more effective at controlling post-meal glucose levels than a single 45-minute session. Walking is your on switch, and resistance training upgrades your glucose vacuum. Together, they hit insulin resistance from both sides. Immediate clearance now and more powerful suctioning power. Finally, protect sleep and reduce stress. One poor night's sleep can reduce insulin sensitivity by up to 25% the next day. That's not a moral failing, it's cortisol and circadian biology. Build a wind down routine. Dim the lights, screens off, a few minutes of breath work. If it's appropriate for you, magnesium glycinate, around 275 milligrams, about an hour before bed, can support relaxation and deeper sleep, and ashwagandha can help regulate cortisol. The result is not just better sleep, it's a calmer liver overnight and steadier morning numbers. Okay, who tends to benefit most from berberine? Adults with insulin resistance, prediabetes, type 2 diabetes, metabolic syndrome, or fatty liver. The physiology that underpins those conditions matches the pathways berberine influences. If you see morning highs despite good dinners, notice that stress or sleep reliably bumps your fasting blood sugar, or you've lost muscle after 40 and your numbers don't match your effort, berberine can be very helpful lever while you get the foundations humming again. Results come on a predictable timeline. Digestive adaptation in the first 2 weeks, fasting glucose shifting over 4 to 8 weeks, A1C and lipids following over 2 to 3 months. Weight changes are modest if you change nothing else. Combine berberine with a fiber-forward plate, lower saturated fat, resistance training, post-meal walks, and better sleep, and you'll feel the difference sooner, and your labs will reflect it. A quick word on quality, because the label is half the story. Look for Berberine HCl at 600 milligrams per capsule, third-party tested in an accredited lab for heavy metals, microbes, and potency, and made in FDA-registered, GMP, and NSF certified facilities. This is why our community uses Jade Supplements Pure Berberine. It's 600 milligrams Berberine HCl per capsule, standardized and third-party tested, manufactured in certified US facility. So one capsule with breakfast and one with dinner gets you to the clinically effective 1200 milligram daily dose without swallowing 8 underdosed pills. If you want a simple way to begin, here's what the first 12 weeks often look like in my practice. In week 0, log your baseline, fasting glucose, a few post-meal checks, sleep, steps, and your current meds or supplements. In week 1, start 600 milligrams of berberine with your largest meal daily. Begin walking 15 to 20 minutes after 1 or 2 meals and start a beginner resistance routine at home. Bands are perfect. I will leave the link to a free exercise routine below this video. Push fiber to at least 30 grams and start trimming obvious saturated fats, butter, cheese, red meats, bacon, coconut oil. In week 2, move to 600 milligrams with breakfast or lunch and 600 milligrams with dinner. Keep the walks and 2 to 3 resistance sessions weekly. Aim for 35 to 40 grams of fiber and keep saturated fat low. Add a magnesium windfall if it fits your situation. At week 6 to 8, reassess fasting patterns and morning numbers. At week 12, check A1C and lipids with your clinician and adjust the plan. All along, remember the goal. Align signals so your numbers match your effort without extremes, without fear. So does berberine really lower blood sugar? For many adults with insulin resistance, the answer is yes, when you respect the details. Choose the studied dose, the studied form, and pair it with habits that restore insulin sensitivity. Fiber first eating, low saturated fat, resistance training, plus post-meal walks and better sleep. It's not a cure, it won't melt fat overnight, but as a tool, it can meaningfully support lower fasting glucose, better A1C, and healthier lipids. So you can wake up with less anxiety, enjoy meals again, and focus on living, not micromanaging numbers. I put together a simple berberine protocol plus morning blood sugar fix checklist below. Dose, timing, food pairings, the 15-minute walk plan, and an easy bedtime routine. If you and your clinician decide berberine is right for you, I've linked the exact 1200 milligram product our community uses so you can match the dose used in trials with quality you can trust. Each capsule contains the clinically meaningful dose of 600 milligrams of active compounds. Take one in the morning and one in the evening with food to reach the full serving size of 1200 milligrams per day. If this clarified things, please give this video a like and subscribe to our channel. I would really appreciate it if you shared it with more people who might need help lowering their blood sugar numbers. Take care, and I'll see you in the next video.